Welcome to the Dental Marketing Guy show. I'm the Dental Marketing Guy, and today I am joined by Dr. Eric Jones, who you may already recognize from the lecture circuit. Dr. Jones, met him at the townie meeting here at the Cosmopolitan this year in Las Vegas, and let me tell you, huge amount of value you're about to get for your practice. If you've ever thought about implants, certain elective procedures, and how these high margin procedures can actually, meaning high profit margin procedures, can actually help your practice grow. Dr. Jones has a story of how he helped his practice, and we're going to talk about some of the techniques he's used in marketing. And first of all, how are you, Dr. Jones?
I'm good, man. Thanks for having me.
Absolutely, it's a huge honor. Let's talk about a little bit about your history as a dentist, and maybe some of what you've done in your practice to help spur on the cases that you like to treat.
So, sure. So I'll tell you, I started a practice in 2011. So with it being like a new practice, it was kind of like, figure out the marketing side of it or have really skinny kids, So, I mean, we went like full tilt all in. I mean, coming up with a plan and all of that, but, it's not so much that it was almost out of necessity. And then ever since, just watching that fuel our growth has been something that, I mean, I'm definitely passionate about, because that's what fuels, the cases that we want to do, and bringing people in, seeking, what we're actually good at, is the whole marketing side.
Excellent. And, I'm always encouraging dentists to sort of reassess, what is it that you really want out of dentistry? What kind of cases do you want? And really get down to why you enjoy that kind of work. I mean, maybe you can tell us a little bit about, why you enjoy doing certain types of procedures.
Yeah, I think, I mean, that's an awesome point, because you think about it, I'm trying to remember where I read this or heard this, but you think about like sales is really just a transfer of passion, and I'm like, I know if someone comes in and we talk about what their options are, I feel confident that it's not sales, it's not anything like that. It's just when they see what it is we do and what we're pretty good at, I know that they can then decide if it's a fit for them or not. But I think now it's especially hard with just, everyone you'll see out there is like, family dentistry, or treating you like family, or, trying to be everything for everyone. So I think, looking at the scheme of it, if you can pick out what it is you think you're good at, what you enjoy doing, what you're passionate about, I mean, that transfers over to the patient, especially even from a case acceptance standpoint, from a looking different, and not being the, one of 10,000 flyers they get in the mail, offering a cheap cleaning or a, free exam or $100 tooth extraction or something like that, So I think, that was huge for us in saying, being a little bit different, I'm almost like Purple Cow, with Godin's thing, but it was like, standing out there and being congruent with that. It's not like you can say, oh, we do all these things, and then, the patient gets in there and you're practicing out of a dump, you know what I mean? But, doing everything right, from phone to how the office looks to how you handle, that new patient experience. And that all starts with even, marketing, getting the phone ring.
Would you say the internal marketing, from being a specialist, from positioning yourself as someone, of course, in dentistry, if you use the word specialist, it might mean something.
Right.
But in the marketing field, I guess we could say focus, by being focused on a certain type of procedure or set of types of procedures, would you say your internal marketing is spurred on from that?
No, I think it absolutely is, because that is what, like, you're used to talking about. You know what I mean? So I mean, all marketing knows it gets the phone ring, and it's very good at it. But then from there, so you're on your own. You know what I mean? I mean, you can have the best marketing in the world, and then if you're blowing, 7 out of 10 phone calls, it's not going to do you much good, But I think, no, absolutely. I mean, most of it's internal, but it's just a continuation, and a congruency of message.
Yeah, and so you're part of a group called Clinical Mastery Series. Did I say that right?
Right, you did.
Yeah, excellent. So, having an easy to remember name, that's important. So I was talking to John Nosty over at the townie meeting, and then I met you and Jason, and we were talking about, well, his speech. I remember one of the parts that really stood out to me was how you can walk into his office and the hallways are lined with pictures,
Mhm.
and they're all his cases. You've done something similar to this, or
Right. So yeah, and I was about to say I can't take any credit from it because I stole the idea from him and definitely Jason Olitsky. But it's just having think about what is it we do. Like do you walk in and see like a 1989 Zoom poster up? You know what I mean? Like is that really about what you do? Or in our case, we took headshots. We took before and afters. We had them printed on like a little standout from the wall, and then just like tile the wall in those. So I think you want the patient to know they're in the right spot. You know what I mean? And the last thing you want is to advertise and say, "Oh, I'm the implant guy. I'm the implant guy," and then they get in there and you don't have a single photo of an implant case to show them, or you know what I mean. All you have is the old skull model from dental school that you're breaking out, to show them about implants instead of saying, this is so and so, this is their story. You know what I mean? And that can be for them to come in with a testimonial from that patient, or even video, where they're talking about their experience or any of those things. But no, absolutely.
Yeah. And so internal marketing, I'm always talking about how huge that is. And, we've had some guests on the show who've talked a little bit about that. So there's the pictures. What would you say as far as external marketing, reaching out? We talked to Dr. Christopher Phelps, and, he talked about some of his ideas on how to reach out to certain demographics in an effective way that's not salesy. And you were telling me earlier about some of the things that you've done that are sort of similar to that. Could you share that?
Yeah. So you know what, and I know we talked about this, and I mentioned it briefly, but even the idea of being kind of simultaneous, having multiple avenues of marketing going, and not thinking about it as like we do this, then we do this, then we do this. For instance, I think looking at your whole marketing plan as a whole, some of that needs to be community outreach. Some of that is events. I'll talk a little bit about that. Certainly there's a direct mail component, like in our office, there's a huge web component, SEO and SEM component, and, really just tackling all these things, because I think if you pigeonhole yourself into one medium, next thing you know, you're like, all the companies that are gone now that dominated, you know what I mean? Like even like Polaroid, you know what I mean? Like who would thought that, that's what we called film for forever, and, Kodak. And, you know what I mean? They're essentially that division's gone because times change. So I think, even if it's, I know you asked me about events, but even if that is, getting out in front of people talking about implants or something you're passionate about. Implants, just like Dr. Phelps, is something that, we started doing like education seminars on. And the first one we had, I'm thinking like, no way someone comes to this. And we go in, and it was in a like retirement community, and it was like 80 people in there. And I was like, holy cow, like, who wants to hear about implants? I was thinking it'd be like 3 people, and I was ready, embarrassed in front of like one person, talking about this. It was a packed room. So, what I mean? But I think coming up with a comprehensive plan and just, working on multiple fronts and not being, not outthinking the room. I know sometimes even that first thing, thinking about an event, we were worried about, what kind of, do we get a deli tray, a cheese tray? Like, what do we get? What do we, all the stuff. And then by the time we did our third one, it's just like, let's bring some bottled water and we'll pick up some fruit on the way there, and just getting out there and meeting people. And then even when they see us talk about implants or whatever it is, they can tell, that's something that we have, experience in, a little bit of expertise in, and are passionate about.
Yeah, and so you get in front of these audiences. I mean, obviously, being a retirement community, they're in the market.
Mm-hmm.
They've decided to join this seminar, which, for those of you who might have not heard, that was 80, not 18 people showed up,
Mm-hmm.
80. And that's incredible. So these are all people who have decided that they want to learn more about implants. And of course, these communities, they don't want you to come in and pitch them, right? So you're not going there with the intent of being like, okay, it's $19.99 for.
Right. And yeah. And I was about to say, like, it's funny, like the first, even 2 we did, or even 3, like we do it, we tell them like who we were and all that. But then, at first I was afraid they'd be saying, the community would be upset if we brought in any kind of material. So we didn't bring anything in. We just told them who we were. The girls had some business cards on. They went with me, but like that was it. And then, it's funny, like it took a little bit of time. I thought, oh, this didn't work. And then about 2 weeks later, we got a call, from a new patient about it, and they went to talk about implants. They'd already been thinking about it for years, and then finally the time was right. And then that kept happening to the point where we get called 9 months later. A lot of times it'll be about implants, and then that was the treatment plan. Other times it may be simpler, it may be more complex, but no, the patients that would come in, they're like, oh, well, we already met Dr. Jones. I have another dentist I work with, and it was so funny. They're so insistent on seeing me, like I was like the expert on it. I'm like, I mean, we are passionate about implants. We do a good many, but just there, them coming in wanting to see me like for that, like I'm the guy, was kind of fun and neat to see.
Yeah, and so you don't even need to call yourself the implant guy. You're just
no. So we did it all, and then once we're there, and it's like they already feel like they know you, and there's just like there's no tension, And even in our seminar, one thing we talk about was just like ballpark national cost. So it's like we already have someone coming in knowing, thinking they know what they need, knowing about what it costs, knowing a little bit about the process because they were there. And then, it's like they're an educated, informed, like ready to go versus, feeling like you're starting from scratch. So,
in dentistry, the word sales is kind of a dirty word.
Yeah.
But you hit the nail on the head when you said sales is the transfer of that passion or enthusiasm. And so that's really, really clear. Like once a person likes, and trusts you as a dentist, and you're passionate about, if you're enthusiastic about getting them an implant, that's the winning combination. So that's sales right there. If you really break it down in an effective way, would you say that's pretty much your sales process, is just being enthusiastic, being honest, and just having the consumer be informed and know the expectations?
Yeah, no, and I'd say like that's entirely it, is just like meeting that person where they are, eye to eye, like hearing their story. I have a team member that does just that does a lot of that process for me, but really finding out a little more about them. And then from that, it's just giving them their options, and not picking for them, and kind of laying it all out there and letting them, decide what it is they want. And I think even like we talk about having photos on the walls, we do a good bit of bigger cases and functional cases and aesthetic cases, even like what we teach in clinical mastery. But it's just that, I mean, I can think of all the ones we've done. I can't think of anyone that's like, nope, I wish I didn't do it. I want my money back. Most or response that are, what, I wish I did this years ago, and then knowing that, and then being able to look a patient in the eye and tell them that it's the truth is an awesome thing. In fact, I just got a text. We seated a case yesterday. And this was a text I got a bit ago, said, wow, loving my new smile. Wish I'd done this years ago. Thank you. With like all the emoticons, so it's like, that's awesome. And to know that and feel that and know that, we'll give that value to, to the patient is, really, it's not about, sales. It's about just telling them what we can do and letting them decide. There's no pressure, whatever they choose.
When you get that momentum, how much word of mouth is, how much of how many referrals do you get specifically for implants from previous implant patients?
I think that's a good question. Exactly, of like say implants, I'm not sure. I mean, we get them, and then those patients that are like a referral, like come in pre-sold, and those are the patients that'll wait 3 weeks to see you. When you could hit 10 dentist offices with a 9-iron, from your office, and they can see them tomorrow. Those are the ones that come in like knowing they want you to see you, and they want to talk to you. But I think a good bit. I think it's that, but I also think it's just the confidence it brings. And with that confidence, knowing that you're competent in it, even if it's a new patient you never met before, and they found out about you from the web or from whatever, or from Google reviews or something like that, they feel that. And I think that that's also huge.
Yeah, Google reviews are pretty huge. It seems like that's where word of mouth is going.
Yeah, it's like digital.
Yeah. We had Maui Bob on the program. He talked about 5-star reviews.
Mm-hmm.
Yeah, it was a lot of fun. And we talked about how word of mouth is still really big. I mean, people do refer people, but I think a lot of the generation of 18 to 34 are what's happening is they do have word of mouth. They do still ask friends and family about who's your dentist, but then they go to Google and Yelp, and they base their decision on that as well.
Yeah, and I think you just made an awesome point. I think it's knowing your audience. I think about like for implants, mostly that's older people that have lost teeth, or and now have the ability to afford treatment or the need, with missing teeth. I mean, I think trying to go fully Google Yelp strategy on, the 65 plus crowd is tough, and that's why I talk about you in a seminar, getting out in front of them, what I mean? Kind of meeting them how they want to be met, whereas the younger crowd, I mean, if you're looking at, say ortho or Invisalign, and your target demo is, females or maybe some guys from 22 to 32, that's a huge online presence you're worried about, what I mean? And it's Yelp, it's Google, it's all those things. It's getting people to check in, what I mean, where you are, or like you on Facebook and all that stuff. So I think it's, and also having all those things going, but knowing, where to find who you're looking for.
Exactly. Yeah, that's definitely the case. Well, tell us before you go, tell us a little bit about Clinical Mastery Series and how I think it's you and John and Jason, right? You guys are
Brady and then Mike Smith, and then I have a few other guys that help out as well, like Chad Jashinsky, Eric Farmer, Josh Stelzer. And so originally, I started out as a student with those guys, and then just seeing that kind of dentistry on Dental Town or whatever, I was thinking, gosh, I want to do more of that, but I didn't even know where to start. So, it kind of, I began as a student there, and then, even that transfer passion is getting excited about it, seeing what it did for our practice, and then now even wanting to be like a part of that, because I know how it completely changed, everything we did. I mean, probably the elective side of our practice is probably 50 to 75%. And I mean, it's needs based, but I mean, a partial works, just like an implant does, replace missing teeth, but it's, allowing people to choose. And I think, I mean, that was just huge in, my development and what it did for our practice. And I kind of wanted to be a part of, giving back and helping other dentists see that as well.
Yeah, and so we talked about focusing on the procedures that you want so that you can get the patients that you want, not trying to be everything to all people, knowing your audience. Would you say, what would be 2 quick tips, if there's nothing else from this interview that anyone remembers, what are 2 quick tips that are a good takeaway for our viewers?
Oh, I mean, just like we said, I think knowing what it is, you want to do. And being clear about that, and then positioning yourself to get the training. If that means going to courses, if you think you want to do aesthetics, like that's great, but being able to deliver on what you say you can do is huge. Because like all we really have at the end of the day is kind of our our reputation, our word for what we say we're going to do. And I think following up on that, if that's saying we're going to follow up in the office with calling a patient or bringing them back in, or calling to check on them, or if it's saying I can make your smile look great, your teeth look great, or make get you so you can chew or function, or any of those things, being able to do it. So I think knowing what you want to do and then preparing yourself for that, as far as what you need to do clinically to get training, what you need to do to really create an environment where you can bring that kind of patient in, and then know that you can deliver on what you say you can do, and finding those patients too. I mean, it does you no good to know how to do everything in the world, but not have the have 2 new patients a month, and never get a chance to do those things.
Well, you heard it here first from the Dental Marketing Guy Show. Dr. Eric Jones, thank you very much.
Thanks, Justin.
It's been great having you. I'm sure the viewers have some really good actionable data. That's what we're all about here at the Dental Marketing Guy Show, is how to get you to grow your practice the way you want it to grow. And so if you have any questions for Eric, for myself, feel free to reach out. If this is in the YouTube comments below, on Dental Town, the Dental Marketing Guy blog, wherever you see this on social media, feel free to reach out. Once again, thanks for listening. I'm Justin, the Dental Marketing Guy from dentalmarketingguy.com. And thanks again to Eric Jones, Dr. Jones.
Yeah, absolutely. Thanks, Justin. It was fun.
Excellent, excellent. I'm glad you could join us. Till next time, thanks for listening.